Hi, I'm Jered Wells. I'm a clinical imaging physicist with Duke Health.
And I'm Ehsan Samei, the Chief Imaging Physicist at Duke University Health System and the former chair of the board of the AAPM.
We're excited to introduce to you a new paper just recently published in AJR titled The New CMS Measure of Excessive Radiation Dose or Inadequate Image Quality in CT, Issues and Ambiguities and Perspectives from an AAPM commissioned panel. Computed tomography, or CT, is ubiquitous in the practice of medicine and plays a crucial role in diagnostic medical imaging. Recently, the Centers for Medicare and Medicaid Services, or CMS, instituted a new electronic clinical quality measure, or ECQM, aimed at evaluating CT radiation dose and image quality. This measure has been integrated into major CMS payment programs and will impact hospitals and clinicians starting in 2025.
The measure is intended to assess whether CT scans exceed established thresholds for radiation dose or image quality. However, in reviewing the measure specifications, our panel identified a number of scientific, technical, and operational issues that would impact its implementation and interpretation. Left unaddressed, these issues and ambiguities could result in variable measure implementation, undue cost and burden on practitioners, an inconsistent and even possible negative impact on patient care. Unaddressed, they can ultimately compromise the measure's intent.
The measure evaluates a facility's or clinician's performance based on the proportion of qualifying CT studies that exceed defined dose and/or noise thresholds. The results are incorporated into quality-based payment adjustments under the Hospital Inpatient Quality Reporting, or IQR program, the Hospital Outpatient Quality Reporting, or OQR program, and the Merit-Based Incentive Payment System, or MIPS. Reporting requirements and impacts on reimbursements vary between programs. Participants in the Hospital IQR program and MIPS have the option to report this ECQM, whereas participants in the Hospital OQR program may voluntarily report on the measure up until 2027 when reporting becomes mandatory. Reimbursement implications for all programs have the potential to compound over time.
A multidisciplinary expert panel convened by the American Association of Physicists in Medicine, or AAPM, systematically reviewed the measure over the period of a year and identified 20 specific issues related to its implementation. These issues are categorized into 5 main areas of measure applicability, data categorization and metrology, informatics, performance expectations, and broad implications. As examples, these ambiguities include those related to the non-standard nature of computed measure elements and the reliance on limited validation work. The metrology for noise itself does not account for variations in CT acquisition parameters, reconstruction techniques, or image quality factors such as spatial and temporal resolution, which are critical to the diagnostic use of the images. Further, the integration of the measure and associated software into existing healthcare informatics systems presents significant logistical challenges.
The panel has provided detailed recommendations to address some of these concerns. These recommendations include clarifying the definitions and derivations of dose and noise metrics, recognition of operational impediments, and ensuring alignment with established standards. Additionally, the panel strongly advocates for an open and collaborative approach to refining the measure, including standardized validation procedures and ongoing assessment of the measure's impact on clinical practice. This would support more consistent and relevant implementation across diverse healthcare environments without compromising patient care. In summary, we believe understanding the implications of this measure is essential for all professionals involved in medical imaging, including radiologists, medical physicists, and healthcare administrators. Towards that goal, our paper offers a detailed review of the measure specifications, potential implementation challenges, and recommendations for improvement.
We believe having relevant quality measures in medical imaging is important. We also believe that for a measure to be truly effective, it must be transparent, standardized, and its intermediate variables accessible to practitioners and to the broader medical community. Our panel advocates for an open source, community-driven and holistic approach for quality measures in radiology, one that can ensure consistency, scientific rigor, and real-world relevance and applicability.
So we encourage those involved in CT imaging and healthcare policy to review our findings by following the link below to access our manuscript and contribute to the discussion. Ensuring the accurate and effective application of this measure is an important step in maintaining high standards in medical imaging.